Hey, good morning. Dawn here. Whoops. I'm going to deal with a pretty tough subject today, but maybe 5 or 10 minutes. First, I want to review quickly some things I've said in other videos. This is basically I provide precautions, warnings, concerns about pursuing counseling, psychotherapy, psychiatric therapy. And in my previous videos recommended establish a relationship with your therapist. That is, know some of their background and make sure your therapist has asked you and has showed interest in what your background is, where you're from, part of the neighborhood, family background, education. Some don't really seem to care at all. They just have a plan. Other things I was cautioned about, especially in seeking psychiatric care, that it's sometimes very easy to a psychiatrist to help you're depressed, here's some pills, push some pills across the table, when in fact, whether it's depression, anxiety, or whatever problem that is brought to a psychiatrist, counselor, psychologist, mental health counselor, social worker, often, if not always, a rather complete evaluation is needed, and that would involve medical, psychiatric, possibly CT scans, MRIs. It should be complete. Sometimes people are being treated for a disease that doesn't even exist when a disease that does exist is being overlooked. Look into those warnings. Today I want to deal with the most difficult subject, and that's what's sweeping the nation, and that is the not opiate addiction. I'm dealing with the death from opiate addiction. Opiate addiction is handled easily. Just keep the opiate addict on an opiate, and they'll stay alive. That's the unfortunate part. And the solution for a person who's an opiate addict deals with how does one ever get rid of the craving for the opiate high. And some say it never goes away. And in that case, the opiate addict has one choice, and maybe one choice only. Opiate addicts can go through rehab, and you'll hear the stories 5, 6, 7, 8, 10 times through rehab. A boast of 3 months, 6 months, 4 years even of recovery, abstinence. The craving remains, and just recently some famous singer, I won't mention her name, after 6 years of being opiate-free, turned back to opiates. And in the process, we've learned of many opiate addicts dying from the overdoses of medications that they now can almost get only on the streets. So the solution is, and my belief is, and I'm not quite sure, so you take this with a grain of salt or consider it yourself, the craving, my understanding, is so bad. I haven't been there. I'm not an opiate addict. I'm not a recovering opiate addict. I've took 2 opiate pills for several years for back pain, never increased them, never got addicted. Now I go to a doctor. They want to send me through MRI, CT scans. I just quit it. I was taking 2 simple pills for 6 or 7 years because of a back problem. So I'm not suggesting that I ever had the craving or the addiction. Now I'm taking naproxen and acetaminophen, and it seems to help. It gets me by. Now, regarding the cures for opiate, I encourage you to read the obituaries in all your local newspapers, because what I'm finding in local newspapers, sadly, that people between the ages of 23 and 39 or 40 or 42, report says died suddenly at home. One after the other. I mean, almost daily, at least several times a week in a local newspaper, and this is in the area of Mahoning County in Youngstown, Ohio. I read of young people, otherwise seemingly healthy, dying, found suddenly that they died at home. So I would encourage coroners, police departments, sheriff's departments to report all of these deaths that are reported sudden death at home, and that the coroner's reports adequately state, without stating the name of the deceased, but there were 7 overdose deaths in such and such city this week. There were 37 such and such deaths in this county. I can point out, for example, that in a county nearby of about 200,000 people, in the first 3 months of this year, there are nearly 30 overdose deaths. Now, the issue is that the crackdown, 15 years ago, they started these opiates, Oxycontin, oxycodone, they flooded the markets with it, and that drug was able to be used the same as heroin. It could be cooked, melted, run in the veins, and it was a safe, it was not safe, it was a cheap way to get a high from a heroin type high. And once a person starts in that, they're going to be driven to get back to that high. I would also point out that many people who get addicted to these drugs do in fact start out with a real disease: gastrointestinal problems, depression, back pain, injuries, and if they take an opiate at a reasonable dose, probably reveal the pain. When they get to a certain dose, they get this blasted high, and I've had people describe it. There's nothing like it. Now I'm going to get around to the cure for opiate addiction. You're reading a lot about how it's been how they've reduced the number of drugs that are being provided, how the doctors are now compelled to reduce the number of drugs that a person takes, that they're compelling everybody who takes these drugs to do urine drops at every visit or on random visits. Unfortunately, and you've all heard that in 2017, 70,000 died from heroin or fentanyl overdose deaths. That's a strange way to have to look at a cure. They're not addicted anymore. And if you ask about what are the current cure rates, how many people have been cured in the last 6 months, in the past year, you can't get that figure. You can get figures on how many people have been cut back on drugs, and basically these are people that are going to doctors and saying, I got back pain. Well, you can only take drugs for 5 days. These are people that probably won't become addicted to begin with. But those heavily addicted have to have heroin in some form every day until something is found that prevents the craving, and that has been found. There's medication called Suboxone, medication called Subutex. And methadone is long-standing, 40, 50 years of methadone. It satisfies the opiate receptor without giving the person the extreme high. So it reduces the craving, keeps them in a more normal state of mind and functioning. That is the only thing I know of right now. Unfortunately, some people who will get these Suboxone, Subutex, or methadone, if they can get it and sell it, they will sell it to other people who are addicts who need it and trade it in for really the hard stuff, the heroin and fentanyl. And of course, fentanyl is poorly controlled. Nobody knows how much is going into these little bags of that drug, and it's killing people. So if you have a family member, a friend, you must get them to a point where they're on a opiate substitute. These are opiate based, I believe, but they're substitutes. Just one more example. I've known of drug addicts who are so destined to reduce their withdrawal from opiate that they go to a drugstore and they'll buy up every bit of Imodium, which is an anti-diarrheal drug, and the diarrhea being a side effect of opiate withdrawal, and take 20 or 30 or 40 or 50 pills of Imodium, which is in some way an opiate derivative. You can't get high from, but does solve some of the withdrawal problems. Trying to figure out how I want to wrap this up. Narcan. They're finding people, they think they're saving, well, they are saving. They find a person unconscious, leaned over a table or over the front seat of their car, and they say, well, they've overdosed. If you've watched these reproductions on TV, and The Sopranos was a good example, people that shoot up with heroin, they don't say, oh boy, I got my heroin, I feel great. Almost always, maybe not always, maybe very often, they fall off. They doze out and go to sleep. So you find these pictures, slumped over the steering wheel, overdosed. That's a standard dose. It's just that some of those people slump over the steering wheel or slump over their bed and they don't get back up. But that is a common, typical response to mainlining, that is running heroin into the veins or running fentanyl into the veins, and they just nod out. They pass out. Now, I don't know if they wake up in a glorious state of high and feel good. Some just are able to function quite well after all of that, and only function if they've had that. Point is, these are some of the precautions regarding the pursuit of counseling and therapy for the heroin addict. Point is, they've got to have this drug in some form to go free of it. And it may be a lifetime need for things like Subutex or methadone that curbs the craving, but it satisfies those opiate receptors. I know a few people who have been on it for years and are successfully functioning, but they've got to go every day and get a dose of methadone, because typically these drugs aren't prescribed out in bunches, bottles of it. The person has to check in every day for a dose of methadone. I don't know exactly how they're doing it with Subutex and Suboxone, other drugs for curing the opiate craving. Hey, that's it for now. Trying to think of any other tips I've got. Hey, if you got hiccups, I find that a tablespoon of sugar does it. You got a young child, a teaspoon of sugar does it. Some people say, that's crazy. It works for me. I'll try to think of some other little simple folklore, easier on the mind subjects that solve some problems. Hey, thanks. Check, subscribe, let me know, give me some feedback on these things. And I hope this is helpful, because this is a tough one for a lot of people. Thanks. I'm going to turn this machine off now. We'll meet again.